to the top. Okay, so I'm just going to lean you back quite a way, so that's my thumb, and see how far you can go. That's it. Yes. So that left shoulder, is that your dominant side, or you're right-handed?
A right left-hander, but everything else right-handed.
Yeah. So apart from being able to lift it up, does it affect anything else that you?
No, when I swim, I just get properly warm up.
Yeah.
But that's just, I presume, my age.
Is it crawl? Is it? You do mostly crawl here.
Yeah. And that's just from years and years of work on swimming.
Yeah, maybe. Yeah.
That's just what I've just gone.
Yeah, you can see that drop, can't you, onto that side?
Yeah.
I just take that hand and put it on your shoulder, elbow down, that's it. Okay, just drop that down. Head down for me. Okay, so go a little bit lower. I'm just going to turn and pull to one side, that's it. Okay, turn that up. Back. Okay, drop down again gently. So just looking mainly for areas that are not perhaps moving as well as they ought to. They don't always have to be sore, you know, so as you say, it's all connecting, it's a chain, and with your arm it's sort of anchored onto your spine, so it might be the rotator cuff, or it might be the rotator cuff and something else. So let's just raise your arms up for me again like you did. Does it hurt if I take it further?
Right now I can feel it. Yeah.
Where do you feel it?
In my shoulder.
Here?
Yeah, straight in there.
Yeah. Okay, and then go down again. And bend it. So just bring it up, that's it, and then twist it back. Okay. Yeah, you've got, I mean, there are knotty, gristly muscle tissue in there, but you sort of feel it a little bit through there, but it doesn't sit, it sits slightly backwards, so when you've got that adaptation in there, and a lot of the times you haven't got, there's restricted motion there.
Yeah.
You've got something going on in the sacrum there, which is the pelvis, something going on there, something going on there, something going on there, so it's sort of going up. The opposite, so because it was this side, wasn't it, the buttock that you were feeling it? Yeah, so it's the opposite side, so it can be like that sometimes. So I just want to check that.
Yeah, of course.
On your front, and then just to make sure that is your sacrum, and then we'll probably have to make some adjustments to that, and then come back to that. Is that right?
Of course.
Go on to. Yeah, so if you're watching on the camera, if you're watching on the channel, we need to make sure it's whether it's an iliosacral or a sacroiliac, because that's going to then depend on where you're going to make your adjustments to the pelvis and where you're going to put your contacts. So whether it's going to be on the ilium or whether it's going to be on the sacrum, and I think it's probably going to be on the sacrum on this one, but it's going to be it's actually going to be on the other side. Okay, if you lift that leg up, Dylan, just lift it up nice and straight. That's it. And then down again. And then lift it up again as high as you can go. Okay, and then down. And just do that one for me. Okay, and then down. And then fully relax it. And just do it again. Okay, and then down. Okay, that's fine. Yeah. Alright, so we're going to do this sacrum in a second. Alright, so we're doing a two-man or two-person sacrum or lumbar, sacrum pelvic adjustment. So we need fixed points on the lumbar spine, so that's not moving. Fixed points on the shoulder with traction. I'm going to use this leg as a lever. My hand is going to be on the sacrum down here, and then we're going to just put a pull up through there. So you'll feel my hand there, and I'm going to lift these legs up and see whether we can get some movement in there. Alright, so I'm going to just put my hand through your knees into there. Okay, so let that drop. Okay, that's fine. So we're just going to get the rest of it in here now. So we're going to use the leg and the arm as a lever. So let that shoulder go nice and floppy. Let it drop. Okay, good. Alright, brilliant. Go onto your front again. Crunch. Okay. So let's come into CT3, so just let your shoulders just drop. Good, nice. Well done. This time you might want to come around, I'm going to reach under. So I'm reaching under this time, just a little pull on that side. So if you let your shoulder just drop. Good. Nice, alright. Sit up this way for me, just let your legs come around. Right?
Yeah, of course.
Yeah, cool. Okay, let's bring you up this way. Okay, so let's do this junction and come back to the shoulder. So come and have a seat on here for me. Gently over, turn, that's it. Just let that drop. Well done. Head down. A little bit more. Good. Okay, if you slide forwards a little bit more in the chair, so your bottom's nearly off the edge, that's it. And then I can just come around to this bit here. So I'll probably need a bit of paper for that. Okay. Just get a little bit of a grip. Okay, so what I'm going to do is just going to put a little bit of movement, ideally through this last little bit here. So I'm going to just let your head tip a bit. With a slight turn, that's it. So we're going to come across and up like that. So that shoulder, just let it drop. That's it. Good. Nice. Forwards gently. Good. Let it go. Nice. Good. Okay. Let's just bend that a little bit. So I'm going to go down, round, just down, that's it. Good. Good. Good, that's it. Good. Circle that. Are you going to the gym today?
Wasn't planning on it.
No, that's fine.
Why? Can I?
Yeah, well, you can do if you want to. Just probably depends on what you're going to do, really. Did you do your arms last night or
Yeah.
shoulders last night?
Depending on what time assembly finishes, I want to go for a run.
Yeah. Yeah. Okay. Drop that. How far are you going?
18k. I need to run a 15 this weekend, so.
15. Okay, so just go and take the leg up like that. If you hold that there, and I'm going to put a bit of pressure on here. And what I want you to do is to then lower your leg down. Good. Good, and then bend it up again. Oh. And then down. Gonna make you sweat now. All the way, all the way, all the way. Good. I'm going to work all the way down, so bring it up. Good. And then down. Nice, good. Bring it up. All the way up. And down. Okay, one more, all the way up. Okay, that is it. Okay, and then down. Loves it. You can always tell if people go quiet, they just go quiet.
Jeez.
Good. So the reason why I do that is obviously the hamstrings are separate muscles, you've got the fascia entwining them, you've got lots of little nooks and crannies that you can get into, so sometimes you can miss that with a general massage, you can miss it with your foam roller, so you've got to use sometimes your patient's leg as a lever and then their active participation. So once you do that, you can really free off the hamstrings. It needs to be done several times, but it can be quite effective, but it can also be a bit sore the following day, so it's not, don't be surprised if it's a little bit tender, but most of the tension is there. It's there. So just do a little bit more. He's laughing, but ideally he might even be crying, I don't know. So don't forget when you're working on your patients to don't just work longitudinally on muscles, you've got to work transversely as well to really break up the fibres as they all stick together. Alright, Dylan?
Yeah, yeah.
Okay, last little bit, just there. Okay, good. Good. Okay. So if you just come down a little bit, and then we're going to use just a drop on the hip. So you feel that come up, and then you just drop down like that. Okay, so we're going into there. Here we go. Good. Okay, so sacrum, pelvis with the 2-man, and then finish it off with the single pull move. We've got the mid-thoracics, T4, 5, 6, CD junction, OA with the lift, work through the shoulder joint, open out the gluteal fascia, open out the hamstring fascia, and then we'll see how they get on with that. But it's a process, it needs to be repeated so the tissues can actually change over time.